living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Healthcare in America is rapidly changing, and when it comes to improving the quality of patient care, Patient and Family Advisory Councils, or PFACs, are helping healthcare systems improve processes with the patient in mind. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Lisa Sather. Stay tuned to learn all about PFACs in this week's show. Welcome back to Healthy Living for Life. Joining us now is Rhonda Heinrichs, who administers the Patient and Family Advisory Council, or PFAC, at St. Peter's Health. Rhonda is here to talk about PFACs. Rhonda, thanks for joining us.
You're welcome.
Yes, so let's just start out right out of the gate. Tell us what a PFAC is.
So Patient Family Advisory Council is what it stands for. And our PFAC council came about from our CPC Plus, which I'm not sure if you know what that means, but it's basically team-based care.
Okay.
And team-based care takes a holistic approach to how we care for patients, and there's a team of people that surround this patient and take care of them. Okay. Part of that is if you're a part of the CPC Plus, now kind of leading into team-based care, they ask that you have a PFAC committee and a community council. Okay. So that's kind of how it started. My committee that I am on now and that I chair started probably a year and a half ago, maybe a little bit. It probably has been 2 years now. Oh, wow. Anyhow, we started with a group of people that were on a community-wide board that kind of disbanded, and then that's how I kind of got my peeps. Okay, awesome. Yeah. So it has patients and family members, and they serve as advisors, I guess. Correct. And so what exactly are they advising on? Oh, a lot of operational things. You know, what are we doing well? What can we work on? And they just kind of come up with ideas, and then we work on them. One of the projects that we worked on was a packet for new patients. You know, getting to know your new provider, for instance. So the one that we're starting with is Emily Hedham. She's one of our new providers, and she was brave enough to be the first person. So we are just getting going on that. It takes a little bit to get the packet together. And what the packet does is it says, you know, some fun things about her, a little bit personal, sends a picture. We send a magnet with the patients, and it kind of tells them where to go for what. Helps you navigate the system a little bit. Cool. So how many people serve on St. Pete's PFAC committee, and is that, you know, a typical size? What's a typical PFAC size? We probably have 15 members, I think. Oh, wow. About half are community members and half are employees. Okay. And we picked our employees a little bit from everywhere in primary care. And as I said before, we have this team of people that take care of a patient in primary care. So we got one of every type of the team members. We have nursing staff on there, we have a pharmacist, we have a care manager, we have a social worker, and 2 providers. Awesome. And then myself. And is that a typical size for a PFAC committee? Does that seem about right? I think you try to keep your committees, you know, maybe under 12. We're a little bit bigger, but it's kind of grown. But it works. It works well. People are very respectful, and it's not any one person's agenda, so it works for us. So how does the hospital go about recruiting members for the PFAC committee? Well, like I said, for ours, we kind of absorbed another committee. Okay. Mm-hmm. We're actually looking for at least 1 new member. So what I've done in the past is I've gone out to either our physicians or our advanced practice providers and asked them, do you have somebody, you know, in your panel of patients that might enjoy being a part of this and could commit to it? So great. So how much time do the members have to dedicate to PFAC efforts? Well, it's truly an advisory council, so the amount of time commitment can be as much or as little as you want. We have people that one of our agenda items was looking at wayfinding, and when I say wayfinding, I have to explain that because this particular person, he wasn't sure what that meant, as a lot of people weren't. Basically, how to get around in our clinic. And so they took on this and looked at some of our signage and stuff and realized that maybe some of this wasn't great. So we've made a few changes that way. We haven't made all the changes that we kind of talked about because we're not sure on our master facility plan who's going to be where, and we don't want to waste a lot of money. But we've made some good adjustments.
Wonderful. So once a person becomes a PFAC member, is that a lifelong position or
lifetime
term
sentence?
limits? Yeah.
There are term limits.
Okay.
We have half that are a year, and then the other half are 2 years for the community members. The staff members, we kind of just trade off. People take turns. You know, we've had 2 pharmacists, they kind of take turns, or our care managers. So.
Excellent.
Yeah.
So do they receive some type of special training to be able to, know how to participate and what to do as a team member?
No, their only training is to have been a patient or a family member of a patient and experienced our healthcare system and know a little bit about it, the ins and outs, and maybe what needs improvement.
So that's a good point. And I guess leading into that, can you talk about how you address patient confidentiality with these folks? Because they may have been a patient themselves or a family member of a patient, just in terms of confidentiality and making sure that that's, kept in mind.
We actually have not come up with anything that would breach any confidentiality or privacy issues.
Okay.
We don't probably dig that far in, and if they want to share a story, that's up to them to share it, but really we don't have anything we've never had an issue with that.
Perfect. And maybe time for one last question before our break.
Okay.
Any special projects you're working on right now that you could share with us, just high level?
High level, we're looking at a new phone system.
Oh, excellent.
So that will be awesome. The phone system that we currently have doesn't allow us to get the data from it that we need to know, so we know, when our high call volume times and that kind of thing. So we've brought all that information to this team to kind of share with them. Another thing, let's see, that we're working on, maybe someday we'll get to a point where we can do online registration or online scheduling.
Excellent.
We're dabbling just a little bit, trying to see what our electronic medical record will be capable of.
Perfect. Thank you. We're going to pause for a quick break. So we'll continue our discussion with Rhonda about PFACs after these messages. Stay with us. Welcome back. Rhonda Heinrichs is with us. Rhonda administers the Patient and Family Advisory Council, or PFAC, at St. Pete's Health. Thanks for joining us again, Rhonda.
You're welcome.
So we've been talking about PFACs and PFAC members, and so could you talk a little bit about the PFAC team members maybe being kind of a conduit to the community? Is that an accurate statement?
That's a very accurate statement. They're kind of our liaison. We give them information about what's going on. We end every meeting with our good news, things that have happened that are great. And we want them to help us share the good news. Kind of through the whole meeting, we work through things that we should be working on, that maybe aren't such good news and areas of opportunity. But we want them to help us get the news out to the community that we are working on things. And we know that we have areas of improvement. But we're trying hard.
That's outstanding. So what kind of feedback do you get, either from folks at the hospital, patients, or both, about having a PFAC at St. Peter's?
What kind of feedback? Well, I have to tell you, I personally enjoy it so much. You come there and I get a little bit nervous when I have to run the meeting because I never know what to expect.
Absolutely.
But we always come out of there with great ideas, great questions. Most recently, we had somebody that wanted to learn more about the safety or the security of our electronic medical record. So we invited Dr. Jonathan Griffin to the meeting, and he was able to kind of ease everybody's mind there that we have a very safe and secure system. Another thing that came up was opioid use within our Helena area, and that's one that we'll tackle at another time. But we just learn a lot about different things by inviting guests, and then our community members get to share the word with us.
That's excellent. So why are PFACs important to improving the quality of care?
Oh goodness, I think one of the main reasons is that our patients and family members feel heard and maybe have a voice in helping us bring about really good change. So I guess that would lead to patient satisfaction. And then the team that we have there of our own employees, happy employees leads to happy patients.
Sure.
or informed. And we would like people to be informed and know that we want to be transparent and we want help and we want to improve where we need to improve and we want to share our good news.
Excellent. Is this a new concept to healthcare?
I'm not sure. It seems like it shouldn't be new. It's fairly new to me. I took over this close to 2 years ago. And I actually volunteered for this because I thought, what a great idea. What a great idea to get people's input. And in my role, I get a lot of the patient complaints or the attaboys. So I have a pretty good understanding of what's going on and what needs work on, and I think this helps getting input. I think you had our good friend Chris on recently, and just having his input, his expertise, his experience, and then sort of his leadership, it really helps us as a group, and then I keep saying getting the word out to others, but that is a big part of it.
Absolutely. So can you talk a little bit more about the shift to person-centered or family-centered care? You were talking about that as we just opened earlier. And what does providing person-centered care, what does that really mean?
Oh gosh, we could go on for an hour on this one, but so the patient should be at the center or at the core of our team. So place the patient in the center, and then the team works around them. And so our team consists of whoever their provider is. Maybe it's a nurse practitioner, maybe it's a physician's assistant or a physician, and then that care provider's either MA or LPN that rooms the patient. Then there's a care coordinator, and the care coordinator kind of the charge nurse for the day, takes care of the daily activities of the clinic, watches the quality metrics. And an overarching part of this all has to do with quality and making sure that there aren't gaps in care, that if you need your flu shot, we're going to give it to you today. You don't have to come back for that. That would be silly.
Absolutely.
So we're trying to take care of quality care. Like I said, we have a pharmacist. Maybe you have a new diagnosis of diabetes. Too bad. It would be great if you didn't have to leave and come back for that training. So we have the diabetic the pharmacist there, and he or she can do that education, possibly with a warm handoff. I talked about a little bit about having a social worker there. One of the number one issues in Montana, unfortunately, is suicide. So everybody, CMS, Centers for Medicare and Medicaid, are mandating that we ask everybody every time, have they had any suicidal thoughts? And there's a questionnaire that people get, and I think it's a little bit of an awkward situation sometimes, but that's because we want to take care of the whole patient. And if there's an issue, then we hand off to our social worker. So there's a group of people that take care of this one person, and hopefully we don't miss anything. And our ultimate goal would be to have a very happy patient that is taken care of when they should be taken care of. They don't have to go to the emergency room, even though we have a great emergency room. We don't want them to have to do that. We want them to have their team that can take care of them in their home or in their clinic or wherever that may be.
Makes complete sense to me.
Yeah.
So we have time for one last question.
Okay.
And maybe we can talk about how someone then would get involved with St. Pete's PFAC or any other hospital PFAC for that matter. Yeah.
So we only have the one here, and they could call me.
Perfect. And I'm sure that we can get your information put up on the screen
so
that will be available.
Okay. Yeah.
Thank you so much. I learned so much today. I really didn't have a lot of knowledge about PFACs, and you've really helped open that up for me. So really appreciate it.
Thank you for having me.
Yes, and our viewers will appreciate it as well.
Good.
Thank you.
Thanks.
It's time for another break. Up next, we're going to meet one of the members of St. Pete's PFAC who will tell us how they got involved and how they enjoy being part of the hospital's PFAC. Stay tuned. We'll be right back. Welcome back. We're joined now by Chris Christensen, who is a member of St. Peter's PFAC. Thanks for being on our show, Chris.
Bet.
So how long have you been with PFAC?
I've been there since the inception of the program.
Okay, so tell me a little bit about how you heard St. Pete's was looking for a PFAC member. How does that work?
I was in my doctor's office, and the nurse practitioner I was dealing with asked if she could put my name in for it. And I said, yeah, just remember, I won't keep my mouth shut. And so she put it in, and then they interviewed me, and next thing I knew, I was on it.
Perfect. So talk to me a little bit about that interview, process, or the application process. How does that work?
Okay. At the time, they were working with a consultant, and it was recommended for some accreditation that they had to have a patient advisory council. So I met with Rhonda and also a gentleman from this, and they talked to me about it. I told them my background of working with groups, facilitating meetings, things of that nature, and I guess that's maybe why they wanted me.
Perfect. So we heard from Rhonda about the training that PFAC members receive earlier. Can you tell us about what the training was like from your perspective?
Well, I could joke and say they didn't train us at all, but
That
no, I
sounds
wouldn't say
good.
that. Every meeting there's a portion of it devoted to informing us, training us. For example, this last time we talked about the information technology and how it's affecting healthcare. A couple meetings ago, we had a new gentleman's in that's dealing with the finance. As you know, St. Peter's has had a history, at least by reputation, that you can't figure out your bills and you don't know what you're paying for. And they're addressing that. So every meeting, there's a portion of it devoted to making us smarter, I guess you'd say.
That sounds great. Is there a personal reason or a specific reason why you wanted to become a PFAC member?
Yes, all indications are health is almost the #1 issue involving people anymore. And it's so important to us, and I just thought if I could contribute, maybe it's my turn to volunteer and contribute to it. Not necessarily be a critic, but get involved and maybe I can make a difference.
Absolutely. So can you tell us about your experience? What's it been like being on PFAC, and what's it like to be a PFAC member?
First of all, it's very interesting because you're learning past the surface. They're delving into things. They're very interested in what we have to say. As a matter of fact, sometimes they bring stuff to us and say, how would it affect you? And, it's like any large organization, they're good at acronyms. But if you're not a part of it, it can snow you. It can really snow you. So we can provide that to them. Take it from a patient perspective that doesn't have a background in, let's say, finance or something else, and then you read it and you go, what language is this in? It's not in English. So I think we've provided that to them. They've asked us to look at things. And then I personally have done it. I've talked to people and told them I'm on it, and they tell me of their concerns, and I'm able to take it back, and maybe not even in the meetings, but follow up so that some of those confusions, those angst that people have can get resolved.
That's excellent. Is there a specific project that you have worked on that you've really enjoyed, of all of all of the issues you've discussed?
I'd have to say that one-on-one when people tell me their frustration, and Rhonda's excellent. When I mention it to her, she's on top of it. If it's something she doesn't deal with, she directs me to the right person. I found that very good. For example, the North Clinic, it's near my house. It was very frustrating going there. They have an urgent care. It was very frustrating getting in. You could stand in line for 30 minutes and nobody talked to you, and they'd have multiple lines that you go, if I'm in the wrong line, do I have to wait another 30 minutes? Those are some of the issues they're addressing, and I think you get that from a patient perspective.
Certainly.
And I think that's good to provide that to them.
Excellent. Have there been any challenges that you've identified, in participating and being on the committee?
Sure. Lack of patience on myself. Sometimes you want things to move faster.
Sure thing.
And we address some issues. Here's a term, like if you're not on the inside, but they called wayfaring. So several of us at a meeting were trying to guess what the word wayfaring was.
Okay.
Well, it's nothing but how do you get where you want to go in the clinic? So we researched various ways. Some places had, colored tape or on the walls or colored carpeting, and research found out that didn't work it so well. Really the best way we found is if you have an information desk and you either can print them a specific map for them or actually be escorted. And now at the clinic on Broadway, they have someone there that'll greet you, help you. That feels good. If you have somebody, especially they come from out of town.
Absolutely.
They're worried about getting a parking spot. How do you park? How do you do this? Then you get in there and then you don't know where to go.
Absolutely.
So that's been good.
So we just have time for one last question, and really from a patient perspective, what impact do you think PFAC is having on improving healthcare in this community, and just maybe a few sentences?
I think the big thing we're able to do is provide a good interface to the non-medical. Give them that perspective that maybe they don't think of, because they're in it every day.
Absolutely.
Working very hard.
That's excellent. Well, I want to thank you so much for being here today. It's been just a pleasure talking to you.
Thank you.
Excellent. I'd also like to thank Rhonda for sharing her experience as well. We appreciate your time, and thank you for tuning in this week. We hope you enjoyed our show, and we hope you'll come back again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.